Ever wonder what everyone's doing on their phones? They're banking with Bank of America.
They're saving, planning, and budgeting all before dessert.
Digital tools so impressive, you just can't stop banking. What would you like the power to do?
For this opportunity, on behalf of the 10,000 plus Michigan employees, most of whom are here in Detroit, as well as the 20,000 members that carry our card through our market relationship with the Chamber. We are delighted to be here. And as Sandy said, this is such a thrill for me to have my debut come with the Detroit Regional Chamber because of all the long history and partnership that our organizations and I personally have had. What we're here to talk about today is obviously innovation, but we have to start with the premise that healthcare is incredibly complicated. You can ask yourself, should it be so? But the fact is, it is, and that's what we are here to talk about today. When you think about healthcare, you think about this complex web of systems. You have hospitals, doctors, lab techs, insurers, employers, pharmacists, and it's our job to make sure that all works together as a system. But when you think about it, we have different government regulations, we have different policies, we have different rules that govern our businesses, but in the end, it's really about how we work together, and that is our challenge and how we will innovate to bring that forward. Because when it all comes down together, what we're here to do is to serve people. And people is what matters, and it's why we believe at Blue Cross Blue Shield of Michigan that the best health care is local health care. It's about how we serve our members and what we do, and with that complex system, how we web all of that together to make it work for you. Think about when you have a medical need. You go to the doctor, you get tests. You might go to a specialist, you might go to the hospital, you might go to a pharmacy. When it's all done, you get an explanation of benefits from us in the mail that frankly isn't a great explanation. We'll admit that. How many people have seen that before? And you can be confused. It's our job to make that simpler in working through the whole system. And if there's anything we've learned right now over the last several months, it's that people aren't very happy with the health insurance system and the entire health ecosystem right now. We need to think about where we've been to start to understand and explain part of that. And one need only look at the headlines to think about the pressures that have been on pricing specifically since the COVID pandemic. When you think about what's happened since COVID, I'm sure many of you in the audience put off care that you really needed. What does that mean for utilization? It means it's dramatically increased. It means some of the conditions that you might have put off cost more, and they're more severe than what they were prior to COVID. Think about what's happened in the pharmaceutical and drug industry over this time. It's exciting, some of the developments, but $16,000 a year for GLP-1s for a member, $4.3 million per patient for one treatment of a rare genetic disorder. When we're thinking about innovation and affordability, think about how impossible it is to spread that risk for affordability across the population. Other pressures, we think about the aging workforce and the aging population. Let's face it, there's really good work going on in the state of Michigan around population, but we are old and we're getting older. Think about inflation. Think about your own supply chains. Think about how much you're paying for eggs and what that means relative to all we buy. And think about all of the technology, and technology is a wonderful thing, but it costs money, and all these things are creating incredible pressures on our business. Last year, we took out an average 11% rate increase to our small group customers. The national price of coverage right now for a family of four is $25,000. People cannot afford that. We are approaching an affordability crisis in our industry. And as you see on the slide from a major consulting firm, prices have gone up the last 4 years, and they're expected to continue from all top 100 plans. We have to do something better as a system to drive this out because it's costing us a lot. I think when we start to think about how we talk about this, we also have to understand from where we start, and it's really important to understand where the healthcare dollars go. If you think about the pie that's in front of you on this slide, think of that as $1 of healthcare spend. 27% go to physicians. About 40% go to hospitals, inpatient and out. 20% right now goes to drugs. 7% is what pays for the administration of your health care. That's our cost, and frankly, we need to do a better job at Blue Cross and across the industry in taking some of that cost out, and I'm sure you've heard a little bit in the headlines this week about that. Because the truth is, we think nonprofit healthcare is right. That 7% needs to be squeezed. But when we look at our own financials, we are really proud of what we do in the state of Michigan. We pay $88 million out every day to claims to improve member health and to keep our health system that we're talking about strong. But the truth is, our pricing has not caught up, even with those numbers that I just shared. We've lost $1.7 billion in our core underwriting in Michigan in the last 3 years. And so what are we going to do to affect that pricing? Over the last 10 years, because we're a nonprofit mutual, which we deeply believe in, that means that our money goes into the healthcare system. It doesn't pay stakeholders at 3%, 4%, 7%. Over the last 10 years, our average underwriting operating gain was less than 1% on all of that business. That $1.7 billion that I referenced paid for more healthcare than the prices we brought in. That's not sustainable. We don't want to take those type of price increases out to our best customers. And so what we need to do is innovate to move better with our system. So let's talk for a minute about how we're innovating. Technology is wonderful and it is great, and we're going to talk a lot about AI, I'm sure, today. But the tried and true that is working and needs to be continued, refined, and working is a marquee program we have called Value Partnerships. That is where we align incentives between physicians, hospitals, and us to achieve the outcomes that we want, the access we want, the quality that we want through collaboration and data sharing. And over 20 years, it just celebrated its 20th anniversary last year, we saved $6.3 billion out of the Michigan system in order to do that. That is promoting affordability through innovation. But as I said, we have to talk about technology if we're talking about innovation. And we've been using technology, we've been using artificial intelligence for a while at Blue Cross Blue Shield of Michigan, and most importantly, we have to start with using it responsibly and ethically. But as we do that, I want to share a few programs that we have. We have gold carding. Gold carding is a program with 1,400 physicians in it right now where we have checked their quality, checked their prescribing processes, and as we are so focused on both the provider and the member experience, it automatically approves that which the physician prescribes to create a faster speed of care and better member experience. That's key. How many people have had people caught up in an ER system that can't move through and get speed of care? I'm sure I'll see a few hands there in the light. I would tell you that we're using AI to quickly, in real time, identify those who are caught up in the ER systems and try to move them through care to aid our hospital partners to do that. We're using AI with a program called Member 360 internally that's taking all of the data points to then be able to reach out to members to say, this is the next best action and how we can help you. Think of it as a little concierge program. We have a program called Price Edge, which is a pharmaceutical program that when you're prescribed something that is very expensive, it can match and automatically save you a lower priced drug. And then finally, you've heard a little bit this week in the media about Blue Cross Accelerated, our program to refine our administrative costs. That's also about transformation and making easier use. And frankly, we know you don't want to call your healthcare company, but when you have to, you need the right answer and you need it now. And so that's making it easier through AI to scrape all of our documents for our call center people to be able to get you the right answer at the right time. We're also continuing to stand behind our city and state through innovation. We support the Neighborhood Project here in Detroit. We support the safety net programs over time. And one that I'm really proud of is a Bright Start program that we have with Medicaid that produces culturally competent care through doulas to our Medicaid recipients to make sure that works. So if I leave you with one thing today, I hope I will leave you with our system is critical. Our system needs to work together to promote affordability, to drive innovation. We can do it through partnerships with the entire system, because in the end, what matters is you, our member, and the people that we serve. Thank you so much.
Please welcome special correspondent and anchor at WDIV-TV4 NBC, Christy McDonald.
Good morning to all of you. It's great to see everyone here. And Tricia, congratulations again on assuming your new role at Blue Cross Blue Shield of Michigan. You know, we're going to jump into the headlines, of course, but I want to start off just so everyone can get a little bit of a better sense of who you are. You're a Central grad, Michigan State, and you grew up on a dairy farm. That you have to explain.
Well, I like to say that I'm farm-raised and city-rooted. So one of the great things about Michigan is our diversity here in the state, and I was raised in a 131-year dairy farm, and value that and get back as much as I can to enjoy the great outdoors, but love everything that we have going on here and being in the center of it.
All right, so let's talk a little bit about you stepping into this role on January 1st. In moving things forward, but with your own style. Give us a sense of what your leadership style is and what you want to do in terms of your agenda and innovation.
Well, first, I'm incredibly honored that the board selected me for this role. I've had amazing opportunity throughout Detroit and inside the company, and owe our former CEO, Dan Lepp, so much for that opportunity. It's great. But we're different people. You know, when you think about it, one of the very unique things about Blue Cross is that I'm the third CEO in 36 years. The board hired Dick Whitmer to financially stabilize the company. They hired Dan to diversify that company, and they've hired me to transform the company. And the market has changed. That's what we're talking about today, and so must we. And so bringing that innovation, bringing the technological advances with a relentless focus on affordability and customer experience is what I intend to bring. People tell me I'm direct. Yeah, if you know me, I am. That's my style.
Let's talk a little bit about what made headlines this week in all of the papers, that you are offering voluntary buyouts to employees, trying to cut $285 million this year alone, with a total of $600 million over the last several years, citing the financial pressure that you've talked about and also increased utilization of healthcare services. Talk about what that decision was for your employees, and then how you tackle those costs when it doesn't seem that they're going to be, or those challenges are going to be coming to an end.
Those challenges aren't going to be coming to an end, and that's why when we're finished with this transformation, we will start on with the next one. When I gave my comments, I talked about that 7% of your dollar and where it goes, and it's on us to make sure that's efficient as possible. I would share. It's interesting, that the headlines that got. We believe that is very consistent with our culture, in that one of the great things about this company is you have generations of people who work in this company. In greeting the doors with people, I've had moms and daughters come together to shake my hand in these first couple of weeks. It's exciting. And we want to honor the history and the legacy of the people who have worked there, with people being able to self-select and say, this is my time. And that's why we decided to do it this way. And so, most businesses are looking at the cost of what it costs to do their business, and we're doing it, and we believe we're doing this in a culturally sensitive way to hit our goals.
You talked a little bit about COVID-19 and how prices and things have changed up now to 2025. We would have thought that maybe we would see some of the financial pressure back during COVID. So tell us, or explain a little bit more in detail why it's catching up with everything today.
Well, I would say, it's really interesting when natural disasters happen, when pandemics happen. Generally, people continue to pay their premiums, but they don't seek the care. A lot of the elective things go away because people are so focused on the issue at the time. That happened during COVID. Think about the amazing work that our hospital and physician partners did during that time in really focusing on those who needed it most. And there were a lot of knee surgeries, for instance, that got put off. And so that for a very short time, that was depressed. Well, what also happens then is we saw screenings go down. We saw vaccinations go down. We saw all of those things happen. There's a price to pay for that. It catches up. And so now when you go back for some of those treatments, it costs more, not only because of inflation, but because, God forbid, the condition may have gotten worse. And so all of those things are catching up.
So I guess how would you form and list for us some of the biggest challenges and maybe frustrations that customers have right now with healthcare? Is it the cost of prescription drugs? Is it the premiums?
We can't talk about the cost of, so I think there are a lot of things. What we've learned is there are a lot of people that are frustrated with our industry right now. If we start with prescription drugs, however, the issue is as much the price of drugs as the cost of drugs. And I would submit to you that, and I'm not a huge one for government intervention, at the same point, how is it that GLP-1s are priced at $16,000 per person per year? It doesn't cost that anywhere else in the nation, in the country, in the world. And so that needs to be addressed as well. I think we're going to get to a point where that has to happen. Certainly that's an issue. And I think it's really important for people to understand that not all healthcare insurance companies are created equal. And so one of the reasons why when we speak, we talk about our nonprofit mission and about how our job is actually to cover people. That's what we try to do. And so we do believe we're significantly differentiated from some in the industry, and it's up to us to tell our story and prove it to our members.
And kind of navigating the road as people try to figure out the cost of procedures or where they can go for a doctor or those prescription drugs. What are you putting in place to, I guess, help people's experience when they're interfacing with their insurer?
This is a lot of what I just talked about relative to a lot of the innovation in the AI. We understand, our premise was healthcare can be complicated. And so we want to make sure that we're investing through AI and through technology to make sure that the digital tools we have are clear, that we have transparency in pricing with our hospital partners, with our physician partners, and frankly, that we create shared outcomes and shared objectives with them to make sure that we're all working together to knit that system together to make it the best customer experience we can for the member.
It's no secret that people can get very frustrated with healthcare, with insurance, and we saw that play out in December with the murder of the United Healthcare CEO. I want to ask you how that maybe has changed what your experience is as now leading Blue Cross Blue Shield of Michigan, and what your thoughts are as we saw this unfold.
Well, first of all, you almost can't speak about the tragedy, and that there's nothing ever justified such as that which happened there. And so our hearts and prayers go out to all the United family and the Thompson family in particular. I would tell you it probably wasn't the best time to become the CEO of a health insurance company, but this is a job and this is a privilege, and it's why we're out talking about what we're trying to do for members, how we're trying to cover people, and how critical it is that we work as a system. I would say that our employees took that very deeply and very seriously as well. One of the great things about our company is in all of our internal organizational alignment surveys, the number one thing that keeps people working at our company is commitment to mission. And what they want to do is cover people. What they want to do is help people. I don't think that is probably the same in every healthcare company, but what I do know is what it is in ours, and I think that is what's most important.
I think what it also brought to light for a lot of people was looking at people who were maybe asking for a procedure or asking for some kind of drug and getting turned down, and the percentage of the patients that had been turned down like that, and started those conversations around communities across the country.
Well, and that's why when I talked about gold carding and this really important program, 1,400 physicians in Michigan are in this program, 15 specialties. are included in this program. And it's automatic approval once submitted by the physicians for physicians who are prescribing, who are recommending appropriate passive care.
You know, some people who have a choice on the marketplace for their insurance or employers who are looking to get insurance, what do you think that they should be considering now in 2025 in this landscape and atmosphere?
I think they should be considering Blue Cross.
Well, I mean, it goes without saying.
Well, I think all those factors. Healthcare is a deeply personal decision, and I think I think it has to start there. I think it's really important. There are plans everywhere that can meet specific healthcare needs, and that's why it is so personal, and that's why the concierge services and the people are on the other end of the line to talk people through one-on-one in a very private conversation about what are the things that you most need? What are your personal health conditions? How do we do that in order to make sure that you have that coverage? And then, one of the great benefits of Blue Cross is we have the widest network in the state of Michigan of any health plan. And so it's very wide access, and that's really important to a lot of people to have that access to be able to go where they need to go when they need to go there.
When you talk about innovation, and you mentioned AI specifically, and you sit there and have to do the master plan for the next 5 years of where things are headed, and you said that's why you were brought on is the next innovation. What do you think are the biggest challenges for you when working with a tool like AI that continues to change, and a year from now, we're not even quite sure what we're going to be seeing?
Well, that was going to be my answer, is that I think we couldn't make a 5-year plan on AI if we wanted to. I think what we have to do is have the elegance and flexibility to be able to move as we learn. But that's why when I started talking about technology and AI, is that the table stakes for that is using it responsibly, is using it ethically. And so if you set up that system and you put it within the guideposts of your mission, then it makes decisions really easy about how and where you have to go. There are a lot of other programs that I didn't reference that we're using AI in bringing those forward. And what you have to do is test and pilot and fail fast, and then learn and go forward. And I think that's the key to enabling this, because frankly, there's so much happening so fast. And when you think about a healthcare payer in particular, think of the data that we have. And so even having the data governance around that to make sure that how you're using that and what's happening, I mean, we have your most sacred asset. And so we have to use that right. We have to use that to improve your healthcare situation, and that's what we're trying to do. But continuing to innovate, continuing to fail fast, continuing to move forward, and keep on keeping on.
I love the phrase "fail fast," because sometimes when you look at an established corporation, you think, we just kind of need to stay the course and we can't fail. Yeah. But talk to me about how you incorporate that in when you are working with your employees and saying it's okay to fail, but fail fast because we need to then figure out what the next road is.
We're working on that. I have to be really honest. We're working on that. I don't think anybody wants to fail, right? But we have to make sure it's okay. We have to make sure that with a small c we celebrate the failures and learn from them, so that we show that nimbleness and then keep charging on.
I think what has been front and center for a lot of people with Blue Cross Blue Shield of Michigan is the role that it's played in Michigan, and especially in Detroit, as a supporter of so many things. 86 years here in the state of Michigan. Talk to us about how you want to continue that and what you see that role.
Well, I like to tell people about myself. I am personally very motivated by health and wellness and our ability to impact that on the member, as well as with our nonprofit mission, the ability to make really good business decisions that still have positive impact on the community and the member. That's why I get up every day, and that's what I do. And I think that has been what's been such a great privilege over time in the relationship with the chamber and the great work there, and the relationship with the city in all of our investments, be it through the strategic neighborhood initiatives, be it through so many of the important community organizations that we have. And I fully expect that will continue under my leadership.
All right, we only have about a minute left, and sometimes I like to do some quick, fast questions that might be a little off topic. Okay. So let's go to favorite type of music to listen to on a road trip through Michigan.
I am the woman with the least rhythm of any person you've ever met, and so I generally have talk radio on. So I'm not, but country if I have to choose.
Okay, country. All right, that's good. Favorite sports team in Michigan?
Tigers.
And, okay, that's right. Poor Lions.
Yes.
Can we have a moment?
Yes.
Okay.
Yes. I couldn't say it. I was afraid what the audience would do.
Favorite way to stay healthy?
Frankly, I like a lot of variety. And so I like to kayak, I like to be outside, I like to hike. I'm hoping to get a little bit up north and cross-country ski this weekend.
Ooh, I like it. Ladies and gentlemen, Tricia Keith, the CEO of Blue Cross Blue Shield Michigan. Thank you so much.
Thank you. It was an honor.
Ever wonder what everyone's doing on their phones? They're banking with Bank of America.
They're saving, planning, and budgeting all before dessert.
Digital tools so impressive, you just can't stop banking. What would you like the power to do?